Okay, so when you are dealing with anticoagulants like heparin and Coumadin, one thing you have to be aware of are the tests that measure the person's status on their anticoagulant. So I think this is kind of just a cute little way to help you remember which test goes with which category of drug. So we see somebody holding up 10 fingers, and we see that heparin has 7 letters and PTT has 3 letters. So together they make 10 letters. They take up all your fingers. So heparin uses the partial thromboplastin time, or PTT, to measure if the heparin has reached a level that is going to be therapeutic. Now it's a little bit different with the Coumadin. You can see that Coumadin has 8 letters, and PT, which stands for prothrombin time, has 2 letters. So Coumadin 8, PT2 makes up 10 fingers, and that helps you remember that the Coumadin test is a PT, or prothrombin time. So, for what it's worth, this might help you remember should you have to figure it out on a quiz or a test, and I'm pretty sure you will. So, these are tests for making sure that your various anticoagulants are effective. So for Coumadin, you use the PT, or prothrombin time. Now this particular blood test measures how long it takes blood to just begin clotting in a tube. Imagine you've got a tube, it's usually a red top tube, that doesn't have any additives in it. So there's nothing in that tube to change the length of time that it takes the clot to form. So the PT, or prothrombin time, is going to take kind of a low number of seconds to start clotting. Blood, when it's interrupted in its flow, starts clotting pretty quickly. And these measurements are all from WebMD, but of course things are going to vary a little bit when you are in various labs. So WebMD says that the PT begins to form a soft clot in an untreated tube in about 11 to 13 seconds. So, 12 seconds is right in between there, and that's a nice even number. So if it were just the PT, that would be easy enough, but we usually pair the PT with the INR. The INR stands for International Normalized Ratio, and the problems that were found with the PT is that depending on which lab you were in, they would use different numbers to try to measure the effectiveness of Coumadin. So a lab in New York City is going to measure something differently than a lab in Detroit, which is going to measure something differently than a lab in San Francisco. And so back in the 1980s, somebody came up with a particular formula, which luckily you don't have to learn and do, that is applied to the prothrombin time, and it gives you just a straight number that indicates whether or not your Coumadin is effective. So the average INR is about 0.8 to 1.1 in unmedicated patients. So if I drew a vial of your blood, you are not on Coumadin, I put it in an untreated tube, it's going to start forming a soft clot in about 11 to 13 seconds, and your INR is going to be somewhere around 1. Just straight number, not number of seconds. So you're going to see whenever somebody's on Coumadin or one of the other coumarin derivatives, they're going to have results that read PT-INR, and it's going to give PT, that's going to give the number of seconds, and then they're going to give the INR, which is just a number. Now with heparin, they use the partial thromboplastin time. That's the most commonly used test to determine if heparin is being effective. So the PTT, partial thromboplastin time, measures the time it takes blood to clot and make a firmer clot in the tube. You pull the blood up in an untreated tube. You wait for the PTT about 60 to 70 seconds, and it's going to form a good clot in the tube. It's, you're going to shake it and it's going to go thunk, 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 thunk. Now, nobody wants to sit around for a minute waiting for blood to clot up when you can add something to it and cut that time in half. So usually what scientists have done is put an additive in the PTT tube, and that makes the blood clot faster. And it's usually a substance called kaolin or some other thickener. Kaolin is a type of clay that is a lot of times used in laboratory settings as a thickener. And the tube usually has an additive in it that just kind of cuts the time in half. So while a PTT may take 60 to 70 seconds for the blood to form a firm clot, then an activated PTT or an APTT is going to take about half that, about 30 to 40 seconds. So when you see someone trying to determine if the amount of heparin is at a therapeutic level, they're going to use usually an APTT, an activated partial thromboplastin time. Now, as we said, heparin sodium is the only anticoagulant that can be given IV in an emergent situation. Somebody comes in with maybe some huge pulmonary emboli, maybe a big saddle embolus just resting right on the entry to the main bronchus. You're going to generally want to start preventing further clotting, keep that big clot from getting bigger, and so you might put somebody on an IV of heparin. So what you do is you have to figure it out by weight. And according to weight, you're going to give a bolus and then put it on maintenance. So you would figure out the person's weight in kilograms, and then you would give a bolus dose, which is 80 units per kilogram, and then you would keep doing APTTs, and when it's therapeutic, you're going to then turn it down to maintenance, which is 18 units per kilogram, which you don't have to remember. Previous book had all kinds of math problems. This one does not, so we won't mess with it. Usually they will measure the coagulation time about every 4 hours to determine the effectiveness of the heparin and make sure that it is therapeutic. Now I'm going to stop this part of the lecture right here because I want to spend some time talking about how we measure the therapeutic doses of both Coumadin and heparin, because it's slightly complicated. It's not terrible. It's very easy to memorize, but it just needs to be gone over. So I'm going to stop right here.